We've shared the struggles of frontline hospital workers inside local emergency rooms and ICUs, true heroes who are saving lives and putting their own at risk. But tonight, employees of a Detroit psychiatric hospital say their safety is being overlooked in the COVID-19 outbreak, along with patient safety too. 7 investigator Ross Jones in Detroit tonight with their firsthand accounts.
In the center of one of the cities hit hardest by the coronavirus sits Stonecrest Hospital. At 162 beds, it's one of the largest private psychiatric facilities in Wayne County, serving men, women, and adolescents suffering from often severe mental illness.
Unfortunately, we're for profit, so we need to keep these beds filled. Otherwise, we can't stay open at the facility.
But tonight, staff inside the hospital is blowing the whistle, saying Stonecrest was slow to respond to the spread of COVID-19 in Detroit and in some instances still hasn't responded, putting patients and staff at risk.
In my opinion, it's very likely that cases of COVID are within the patient population and still within the employee population.
Each of the 3 current employees we talked to asked that we not name them and conceal their voices out of fear of retribution.
Have any employees at Stonecrest tested positive for COVID-19?
Yes, I'm aware of 5 employees so far who have tested positive.
One possible reason for the virus's spread, they say, asking that some employees who showed symptoms of COVID-19 return to work while their test results were pending. In one case, a staff member did return to work and then learned she'd tested positive for the virus.
Now, these people have been exposed to patients, have been exposed to staff. I don't believe they have a game plan for keeping us safe as well as the patients safe.
Staff are also troubled that patients at Stonecrest are still living with roommates. Since the outbreak began, employees say the hospital still operates near capacity. And at the same time, state officials were urging people not to gather in groups. Staff say group therapy inside the hospital continued as normal.
Group therapy was being done in a medium-sized room with upwards of 15 patients and a group therapy facilitator. Social distancing was not being practiced within that group. Patients were sitting at a table right next to each other.
It wasn't until this week, according to insiders, that group therapy sizes were made smaller and social distancing was finally put into practice. Still, staff say they continue to work in close contact with patients, but don't have all the personal protection equipment they need, like N95 or surgical masks. Only cloth, homemade masks so far.
You're putting profit over your personnel. You're putting profit over the patients. And that's what we feel.
Late today, Stonecrest Hospital released a statement. It reads in part, any patient who develops symptoms is moved to a designated unit where the patient is cared for by a dedicated staff equipped with appropriate PPE. Each symptomatic patient is in a single room. They also added that patients are now screened during admission, hospital visitation has been suspended, and patients have their temperatures taken every 12 hours, and employees now have their temperatures taken prior to the start of their shift. Though staff we talked to say that is still not happening. If you work at Stonecrest or any facility where you think safety isn't the top priority, send us an email at tips@WXYZ.com. You can remain anonymous. We're in Detroit tonight. I'm Ross Jones, 7 Action News.
Thank you so much, Ross, as always.